Lobby. This is a webinar kind of that we try to host to bring value to our community at the lobby, whether it's sales training, sales development. Today, we're going to really focus on access, which has been something that the lobby's been focused on at our events around the country this quarter. Charleston was lucky enough to have Brian come down and speak at our Q1 event, and I thought his message was so impactful and powerful. I really wanted to share it with more of our members around the country. Um, so really excited to have Brian on today. He's just got an incredible experience. If you look at his LinkedIn profile, pharma, med device, capital sales, robotics, healthcare, IT, SaaS. I mean, he's done it all. He's sold it all. He's had, a number of different call points and had to get in front of a number of different kind of customers, and be strategic and not only as a rep, but also as a leader. And so just a breadth of knowledge and experience. And so really excited to have Brian on today. Brian, thank you so much for being here.
Thank you, Kendi. Appreciate it. And yeah, thanks for the introduction on my career. I may have done a lot of things, but did I do them well? That's, that's a different conversation. No, great. I'm really grateful for the opportunity. Thanks for having me, for sure.
Yeah, absolutely. Brian, I know there's a lot of things you could hit on in that background, from rep to leader to now entrepreneur. Tell us a little bit about your experience as it pertains to, the medical sales industry, specifically.
Yeah, Kendi, thanks, man. I appreciate it. So maybe even just how quick backstory on how you and I got connected. And it was
Oh,
just like this on a webinar, and I heard what you were building at the lobby here. And based on me being in the industry, I thought this was a great community. Iron sharpens iron, right? How do we all make each other get better? Some of us have strengths, other of us, we all have areas of opportunities. And if we can help each other be successful, make money, drive clinical adoption of our technology, and ultimately serve patients, that's a really good thing. And I wanted to be part of it. So again, I appreciate what you built, and it's impressive to see it continue to grow. But yeah, kind of for everybody who doesn't know me, my name's Brian Duffy. I'm based in Raleigh, North Carolina. I've been a med tech, health tech guy my whole career. Started off as a paramedic in college and then made my way into pharmaceutical sales. And then I had the opportunity to get into medical device. I fell in love with selling with surgeons in the OR. We could talk about that if you like. And then I've kind of had a progression from device to capital to then getting into robotics. I went to business school. I was in marketing and sales. And then after robotics, I started getting into smaller, faster, earlier ventures to startups, and really enjoyed that space tremendously. And now I'm out kind of helping founders of new med tech, health tech ventures either get ready to market, launch, actually execute a launch, or accelerate growth and adoption and revenue generation, which I think everybody here on the call understands that's what we do, so from a commercialization standpoint. So yeah, that's me in a nutshell professionally.
awesome. Thank you. What I love is you've got so much experience in different realms, right? And whether it's pharma, device, robotics, capital, one of the things as reps and people, younger in their career, they think sales is about selling, right? How do I get this person to buy from me? And I think for me, as I got, a little bit more tenured in my career, I started to learn the idea that it's not necessarily about selling as much as it is about adding value to that customer, really understanding their challenges so that you can kind of fill that gap and fill that hole for them, as opposed to forcing them into a situation or trying to push them down to buy your widget. So can you talk a little bit about, your experience and that value proposition that we have to have with customers and physicians and healthcares?
Yeah, happy to. So, a couple things. This is my perspective, right? Not everybody has to agree or align with it, but I'll share like how I operate and how I see it through my lens. And as a med tech, health tech professional, right? I never wanted to be perceived or even considered a salesperson, because I don't really like to sell people anything. And I think everyone here on this call is sophisticated and current enough to recognize nobody likes to be sold to, and nobody wants to be that person probably either, right? And that's, I think, why we all kind of gravitate toward this industry where there's a higher level of professionalism. Our clients are healthcare professionals, and they're, tip of the spear professionals as well. And but that being said, what I really love about the industry is it's the kind of the convergence or the synergies between technology, helping patients, the art and science of medical healthcare delivery, and then me being a person who gets to drive innovation in that space. Like that's really been kind of my niche, and I love that, right? Like anytime I can introduce a surgeon to or a physician to a tool that enables them to accomplish what they're trying to accomplish at the clinical level, within their practice, within their health system, within their community, et cetera, their medical society. That makes me feel good, right? If I can help Dr. So-and-so go from here to here, that's pretty rewarding. And then as someone who represents that innovation, that technology, I want to be paid well for that, right? So I think we're all money motivated here too. But I don't like, I don't think anybody here really wants to sell for the sake of just getting someone to buy something. I think we're all probably a lot more mission driven, and based on the technology and the patients and the operating environment. So that's just how I like to operate. And ever since I was a pharmaceutical rep up until today, it's what I do. It's the only way I know how to do it, to be honest with you.
I love that, and I think it's also a big thing as a sales rep, and also big just in this industry as a whole, right? And as a human, and this I think one of the things that you and I talked about when we first connected is adding value no matter what you're doing, right? Whether you're selling to a physician or talking to a customer or networking, right? Or attending one of our events at the lobby. It's like, how do we lead with value, right? And I think if you do that, it all comes back around, and eventually you see the benefits of that. One of the things that we talk about, and I know it's been a big topic of ours at the lobby in Q1, is access, right? How do we access the inaccessible? And it's something we all face, and no matter what industry you're in, what sales role you're in, even if you're trying to get into sales, right? One of the challenges, how do you get in front of these people, right? And then you realize, all right, now that I got the job and I'm in the sales role, now how do I get in front of these people, right? And it just always is a continuous process of
Yeah.
getting in front of and accessing the right people. And there's a lot of gatekeepers. A lot of things changed post COVID with access as well. So, love to hear your insights and strategies for accessing the inaccessible.
Yeah, that's a long-winded answer, so I'm gonna take a big breath and see what I can share with you all. No, I think it actually goes back to probably the DNA within all of us professionally, right? I think I consider myself to be a bit of a corporate athlete, right? We're competitive, we're driven, we want to, we obviously want to make money, and I think companies that hire us as professional sales, marketing, commercialization people look for that. They need that, right? So how do we get through walls, over walls? Not going to be deterred by the word no, right? Especially in the beginning. So I think everybody here kind of has that DNA. So to your point, Kendi, is like, all right, so the biggest challenge that I see in healthcare for commercialization teams and new ventures is access. How do you get access to what you refer to as the inaccessible, right? Our key surgeon or our key physician, clinicians, but then also all the stakeholders that also surround them that are operational, economic, strategic, legal, even technical buyers. Because in today's operating environment, as we all know here, like just because we get in front of the physician, they're not our buyer by definition. So the word, how do you access all these other stakeholders? Because these other stakeholders, in addition to the physician, they're inaccessible by design. Like they have their agenda, they have their status quo, and they don't want us disrupting it anytime soon, right? But we have a job to do, and we have to put the technology in our physicians' hands and then enable the people who do buy it for those physicians in a healthcare system to procure it, right? And so that's our job. So, and then I have a couple of techniques and ways to kind of overcome the wall of resistance I'm happy to share with anybody. But then here's the other part, Kenny. You talk about adding value, right? And so what do you do if you actually get in the room, right? And now what? And I think this is what enables you to build trust and credibility and continuously add value. Like, oh, when so-and-so's in my office or in my operating room or part of our health system or in a meeting, they add value. They make everyone in that environment better in the form of insights or information, and it's really good. And so, how do you continuously do that? That's a bit of a challenge for all of us, right? And you have to kind of reinvent yourself. And how do you do that specifically with our physician customers? You call on them on a regular basis. You have a relationship. And you have to continuously add value so that you get to stay in the room with these individuals. So happy to kind of expand on either one of those, and the kind of the philosophies behind that if you want, whatever you want to talk
Yeah,
about.
yeah, no, I think it's so spot on, right? You got to get in front of the people, and then you got to stay in front of them, right? How do you
Right.
get there, and then how do you stay there, right? Or how
And
do
then
you
you
get
got to
invited
move
back?
them too, as you know. And then you get in the room, stay in the room, and then move the people in the room, which
Right.
is also what our employers need us to do. So anyway,
Right. So, Brian, a lot of our members, at the lobby are certainly on the sales side, right? And looking to maybe get in front of a customer. So if you're thinking about or talking to a rep that's like, hey, I'm really having trouble getting in front of Dr. X, right? Or this C-suite or this materials manager. Any tips, strategies, as far as getting in front of these people that you've kind of worked on or learned from in your experience?
yeah, this what I'm going to share with y'all now is based out of my pain, my frustration, me is getting blocked by that wall, and then having to reinvent myself to say there's got to be a way because I have to get access to these people. And so what I challenged myself was to do was to get outside my comfort zone and use video. And sometimes people hear video and they're like, I don't know, I'm not using video. How do I use it? All this stuff. But video is a tremendously valuable asset. If you learn how to use it easily, it's not hard to do, but by using video, you differentiate yourself, you elevate yourself, and you can get access to people in a way that maybe everyone else can. Because the first part about getting access is how do you win the war of attention, right? Like the first and foremost. So you got to be different, you got to be creative, and video enables you to do that. And we can have a whole other conversation about the power of using video, but it's really that a human emotional connection, kind of like you and I looking at a lens right now, even though we're talking to one another and being comfortable with that. Like, there's no reason why we can't do that with our phones and make a pre-recorded message and then send that. So that's how I'll use video and on LinkedIn, I'll direct message someone. I'll attach it to an email through a platform called Vidyard or SendSpark. And I try to keep messages between 30 and 45 seconds. And it's all about you, not about me. Like, this is what I know about you. Like, show me you know me. And I'll try to do some research, deliver some value, deliver some insights, and notice this about you, Dr. So-and-so, your practice, your society, your industry, etc. And I thought this would be helpful. You make a deposit and you get out, right? And so that's how I like to make videos. So they go, wow, he didn't ask me for anything. He didn't try to sell me anything. He just, hey, notice this. Thought you'd find this helpful. Here it is. Good luck. Out. And I call those make it deposits. And I just do that with video. And that seems to work well for me. And then I started using video and then delivering it in a physical asset in something called a video book. And again, that's another whole other conversation. But how do you take precision, personalized messages that are insightful and specific to the recipient, make a video, and then put it into a physical asset, and then drop it into FedEx in something called a video book. And some of you may not be looking at the screen right now, but a video book is exactly that. Type in video books in Google's video books been around for a while. And all they do is you brand them, you put your value proposition in them, and then it allows you to make a personalized message. So you can imagine someone pulls one of these out of a Federal Express, and because it's a physical asset, they're holding it, and now it's personalized, and they go, whoa. And boom, you made instant access, attention, awareness, and alignment in one shot because you use something called a video book. So I started doing this, and that's where I started my company, Executive Access Strategies, to help other companies. But this is not a commercial, right? I don't want this to be, but this tool or just using video in general has really elevated me to get access to the point like I would send a video book to someone before a conference and then walk up to them and then Dr. So-and-so would go like, oh, you're the guy who sent me that thing. That's been sitting on my desk for a week. I've been meaning to call you. And that makes me feel really good. And they have a big smile on their face usually when I start the conversation. So video can be super powerful. And then if for those of you who are interested, you can use video before a meeting, like, hey, Kendi, tomorrow we're going to be talking about X, Y, and Z. Look forward to our conversation. Or after a meeting, like, hey, Kendi, we spoke and we talked about X, Y, and Z. Here are our action items. So I use it before calls, after calls, and they're a nice, really personal touch and a huge differentiator. You'd be surprised how few people use video in that capacity. So that's been my secret weapon, and happy to elaborate with anybody else who's interested in learning how to use video. Highly recommend it.
Yeah, no, I love that, and I'm interested to hear, if there's any individuals on the call that are using video or have tried this. But I think that's where we're going, right? With technology, everybody's got a camcorder in their hands now on their phone. It's easy to do, like you said. You can send it on LinkedIn, you can send it text, emails. There's so many ways to deliver it. I think what I enjoy about what you're saying and your strategy is you lead with value, you give some, a deposit as you call it, and then you're out, right? It's not like, hey, can I do this? Will you buy this? It's value. And so I think continuing to add value takes us back to the first thing you talked about, which is now also helping you kind of get that access. Um, for someone
Yeah,
that's never done this before, right? And is maybe sitting here thinking, Brian is wild. I've never recorded myself. I personally hate personalized videos. It's not my thing. I don't love it myself. But share with someone kind of what maybe a first step to take, right? I know the books is a big jump and investments and things like
yeah.
that, but like starting small, right? And just getting used to being on camera and used to sitting that. Where would you encourage somebody to start?
Yeah, so one of the things, like again, video can be intimidating for a lot of people. So let me just like kind of alleviate that as a barrier for y'all because it's so simple. And why video works so well, it's the authenticity of one human being talking to another human being, right? And it's kind of like why we watch television, right? You see a human being and we just connect with them. And so you don't have to be perfect on video. That's what actually makes it better. It's that authenticity, right? So if you just like you take out your phone, we all have one of these, and you just reverse the lens and you just, hey, hold it up 45-degree angles, look right at the green dot, and give a 30 to 45-second, no more message or in the form of a deposit. So here's the criteria of how to make a message via video. If the physician walked around the corner or came out of an elevator and the doors opened and went ding, and you had that moment, what would you say to him? Right? You like, so you think about that. Like, all right, now he's coming down. I know he's gonna be coming around the corner now. We've all done that, right? Oh, he's gonna be walking out of the OR in three, four, two, boom. Hey, and so in that type of scenario, you wouldn't walk up to a cold stranger and say, "Can I have something from you?" They'd be like, "Dude, no." Right? You would never do that. You would just, "Hey man, saw this. You don't know who I am, but recognize this about your practice, or here's what's happening in your society. Saw this clinical white paper. Here's some new data that just came out. We're hosting an educational event. Thought you might be interested in it. One of your peers is going to be speaking at such and such." Like you make that deposit and they go, "Oh, wow, cool, thanks." And you go, "Dr. Smith, thought this might be valuable to you." And there's no reason why you couldn't do that on video. And you just say, "Dr. Jones, Brian here from such and such company. With the upcoming society meeting, I see that you're going to be in Vegas at the conference and just thought you might be interested in, we're hosting a such and such educational event," whatever it is. And you just make a deposit. And you go, "If you're interested, just let me know." And they'll know what to do if they're interested, if they really want to attend, or oh yeah,
Yeah.
count me in, right? Um, I wouldn't recommend sending someone a video via text unless you have a very tight relationship and they have given you permission to say, "Sure, you can go ahead and send me a video." But you can use video cold, like I'm talking about right now, with an email attachment platform or on LinkedIn. But I don't want anybody to overthink this. Like just 30 seconds, something insightful. Don't ask for anything in the beginning until they say, "Tell me more about you," right? And that's what we're trying to do. Make deposits, add trust, add credibility, add some value, deliver some insights, something you think is interesting to them about their practice or their business. And then they'll lean in if you do it well. And that would be my recommendation. But yes, video can be intimidating. I'm uncomfortable, but what's it worth, right? If you got access to your whale surgeon or your key competitor and he gives you, "Hey, got your video. That was cool." Nobody's
Yeah.
done that. You just elevated your game in the form of credibility. And that's hopefully that's helpful for everybody.
No, that's great. It's so good. And I think just taking that first step, I would imagine the more you do it, the more comfortable you get with it. And after a while, it becomes second nature to you.
Look, we've all trained on role plays. We've done role plays. Those are the worst. You get in front of your peers, you got to do a scenario, but they make us better, right? That's why they make us do these things. And so if you do role plays with yourself in front of a lens, you're only going to elevate your game and make your talk track tighter. So it's a good thing for you.
Love that. Nick brings up a great question. I've used Loom before, and one of the things I know if I send somebody a Loom video, it lets me know when they've read it. I would imagine if you're sending these via text or email, you may not know right away or over time whether or not they actually got it. Did they see it? Did they open it? So his question is, what percentage of messages do your prospects open out of messages sent? And then I would also relay that to like what are you using? You mentioned a couple different softwares
Yeah.
earlier. Are you using something that lets you know that like Loom does, so that you know if that physician's opened it and seen it?
Yeah, so let's talk about LinkedIn. So, and I'll talk about all different scenarios. So first with LinkedIn, if I'm connected with someone, that enables me to send them a video message. So, and we all know how to do that, right? And on messages, you can record a video, it's got to be less than 60 seconds, and then attach it with the little message attachment, paperclip file attachment thing, right? And you send it to them. If they look at it, there'll be either their little picture at the bottom right hand corner, and you'll know they looked at it. So there's your validation right there. If you attach a video to an email, there's a platform called Vidyard, Vidyard. Another one is called Send Spark, and I'm not a advocate for these or anything like that. I just use them. I use both of them. They both allow you to get analytics to see if I send somebody a video, where they were located when they looked at it. Do they look at it on their phone or their email, and how long they watched it? Like if they watch a third of it or they watch the whole thing, that's a really good validation. Um, so there's that. Another platform, I think I mentioned this at the talk in Charleston, Kendi, Lavender AI is a great platform for emails because it does the same thing. It allows you to see who looked at it, and then you can tell, hey, they watched me email. So that's a little of the tricky part is sending video. We don't always know if they watched it, but chances are they will, only because you're competing in the war of attention. So anything that you can do that's different, creative, to elevate you, to cut through the noise. I mean, surgeons and physicians are crazy busy, and like they get inundated with tons of emails and people asking them for stuff all the time. And if you're a stranger, you're not even on that list. So if you can do anything to elevate that, I think video is going to be your best weapon of choice to do that.
Awesome, awesome. I love these, and I want to make sure I put these in here right. So I heard Vidyard,
Mhm.
ThinSpark, and Lavender AI.
Yeah, Lavender is a great one. I use all three of them for
Awesome,
sure.
perfect. I put
Here's
those
another
down.
tool for you all if you're interested. So there's a ChatGPT, Gemini, right? We all know how to use AI at this point. Perplexity is something that I use all the time. So let's go back to the conversation about how do you add value? How do you continuously bring insights to someone? And like, how do you know this stuff about me? Not in a creepy way, but like in an insightful way about their practice or again, their medicine, their business, right? Not like, hey, I saw you had 3 kids and they go to such and such school. You don't want to be doing that. That's no bueno. But recent adoption of some new CPT codes or reimbursement, whatever, right? So Perplexity, take that in, and you can type in Brian Duffy Perplexity, and it will spit out like everything about me that's public information, my LinkedIn profile, my business, if you're a physician to practice, where I went to school, and you could derive some pretty cool insights about them, like in a second. And then that's your nugget. You say, hey, Kendi, saw this about you, thought you might find this interesting. And they go, how'd you know that? But show me you know me. That's a pretty cool technique. And that shows that you as a sales professional have done your research on them and that you're prepared to actually engage them. I'm all about, relationships and rapport is important too, but you better bring some value like quickly into the conversation. And that would be my recommendation for everybody.
Yeah. Nice. Thank you for sharing those. I put those all in there. You know, one thing that Nick asked earlier is what percentage of messages would you say get opened? Do you
Yeah.
have any data? Do you have any experience or thoughts there on just kind of how successful? I mean, heck, even 50%, 25% is more than you had before. But
Oh yeah.
any
Yeah.
thoughts there?
Yeah. 80% is zero is, still zero. Um, I don't have metrics that I can just share because I've been
Uh,
using this for so long, but the video book thing asset, the way I deliver it, it's the timing of this, but you can do the same thing. You don't need a video book. So when the message is very well timed, and what I'm talking about is being relevant, right? Relevant value. Like, how'd you know that about me? And that it makes sense to them in that moment. So this is where all the research comes in. You find that, and you're like, this is, I assume this is going to be relevant to you. And then you deliver that in the form of like a video message, like, hey, just saw this development, paper just came out, just saw that such and such joined this practice, or whatever, like industry trend or something of interest in their world. And you just I don't know, this is how you like, they like you after time, over time, and you build trust and credibility, and you're continuously bringing value. And then here's a little tip. So again, adding value, like where do I start? Well, here are the four layers. There's clinical value, right? And we know this about our products and our technologies. It has to deliver clinical value for sure. But then there's operational value. Does it improve their workflow, whatever, their day-to-day operations? Can they use it easily? Can they switch from theirs to yours? There's economic value, and then there's strategic value. So in those four buckets, there's always a place for us to add some value. And what's cool about us as salespeople, I could add some clinical value. Then I can add some strategic value. Next time I talk to them, economic data. And then here's something about, and so I can kind of continuously reinvent myself and not just be the guy who just shows up and throws up clinical data all the time, but now I'm diversified and that makes me more valuable. So just something for real, hopefully you guys can benefit from too. But that's been kind of my foundational layer: clinical, operational, economic, and strategic. And then just know that about your technology in any scenario as well would be my recommendation.
I love that. And that gives, I think, someone some guidance too. If they're a little nervous about that first video, what do I say? Where do I
Yeah.
start? Pick a bucket, right? Pick one of those value buckets and find something there that you can add to that position. As far as emails, Brian, Nick asked, are you using any system? Sounds like you've got some great platforms and tools in your tool belt, but what are you using to collect emails for prospects?
So like collecting emails or writing emails,
He said collecting emails.
like a CRM,
Yeah.
use
Or,
Facebook,
how are you
so,
finding,
okay.
a materials manager, a physician? Is there a certain system you have that's scraping emails, getting email addresses?
Yeah, there's a database called Zoom Info. Again, I don't work for these companies. These are just the tools you should see my screens. I got like five screens open all the time, but I go from one to the next to the next. Zoom Info. It's expensive, but it enables me to get emails, phone numbers, physical address, LinkedIn profile, cell phone numbers. And this is really valuable for not just physicians, but then also all those other stakeholders like the economic, strategic, legal, all those other people, the buyers.
Yeah.
Uh, that information is really important. So yeah, Zoom Info is how I'll get it. And then I can talk about maybe how I email people if you want, or wherever you want to.
Yeah, yeah.
So when doing outreach and trying to get access to someone, right, and make an introduction, add some value quickly, and then make that deposit and get out with no request. Like again, people are like, what do you mean? Not going to ask for something? Because everybody's like, well, what's the call to action? There isn't a call to action until they say, tell me more about you. So you have to make, we talk about touches, like 7 or 8 touches. These are deposits, right? So eventually they'll engage with you, and then that's kind of like their call to action. So I like to not ask for anything specific, especially in cold beginning. And then number two, everything is done on a cell phone, which means if I can't write it on a cell phone, it can't be read on a cell phone, right? And they're looking at this while they're walking down the hall or going from room to room or driving or whatever, right? They're on the move, catching up with administrative stuff when maybe they'll see this. So my recommendation is when writing emails, one line, skip 2 lines, another line, skip 2 lines. And what that does is it makes how they read it so much more friendly. And it's 1, 2, 3, done. Like that's it. And the subject line has to be 3 words or less. And again, you're like, well, how am I supposed to do that? Now you got to go further up in the chain as far as creating their communication that gets you access to be kind of precise and intentional. But it gets you over the wall. So nobody reads emails, they scan them. So 1, 2, 3, point, point, gone. Like it's got to be that simple and easy. You didn't annoy me. You gave me some cool information. Thanks. And I'm on the move, right? And we've all gotten those emails. You're like, oh, dude, I'm not even reading this person's email, as opposed to like, oh, that was cool. Oh, that was cool. Oh, that yeah, you did it again. Like that, and that way, they're building some trust and credibility with us that hopefully then we earn the opportunity to engage with folks later on. So just keep it simple. Basically, is what I'm trying to say. I think to everybody.
That's such good points. You can tell you've been doing this a long time. You've got experience, and you're thinking about the customer and the way they're going to receive it, as opposed to I think a lot of people think, more so how am I, about themselves, right? I'm going to write
Yes.
this email. I need to get this message across. as opposed to you're putting yourself in their shoes. How are they even going to read it, right? They're likely going to read it on their phone. It needs to be short. They got a lot going on. So I think your strategies here are so helpful for so many of us in sales roles.
So think of it like this, okay? And it's never about us. It's never about us. It's always about them. That would be my first, like, if there's one thing you walk away from this call, it's not about me. It's not about my company. It's about them. So imagine, for example, you're reaching a surgeon, and this is really how I operate. Let's say that surgeon's operating on your mother, your kid, in the next 15 minutes, and they're just ready to go into the OR, and they get an email, and they look at something like, oh, cool. All right. I suppose like, oh, right? Which surgeon do you want operating on your loved one, right? With that. So my point is this, like they're really busy. So we want to just add some value, be kind of concise and clear, and then get out type of thing. And just from the lens of our customer and what they're doing, super busy and pulls in a lot of different directions. Everybody wants from them. If you could be the guy who does, or person that doesn't ask them for something, you're actually differentiating yourself, believe it or not.
Love that. Well, and I think that's
What do
so
I
key
think
in this industry, right? You've got to differentiate yourself from your competitors, not just with products, but you as a rep, you as a someone who's adding value to their practice. One of the things I love to do is for anybody that's attending live, I love to give them the opportunity to ask questions, right? Maybe they have a certain situation, maybe they had, so if you're sitting there and like, hey, I'm having trouble getting in front of this customer or approach to an email or a question about video, guys, I'd love to give you that opportunity to ask Brian directly, talk about accessing the inaccessible, having access to Brian here and his wealth of knowledge, I think is so much value. So if you got a question for him, you want to come off mute and ask a question, please feel free to do so. If you want to put it in the chat box, feel free to do that as well, and I can read it to him. But I want to give everybody that opportunity.
please, not all at once.
Any thoughts, questions before we let Brian go?
I'll say just all really great information. Feeling grateful to be able to hear all of this. Thank you.
Oh, my pleasure. Yeah, thanks. I'm here to help. And if you guys have any thoughts after the call, like again, what Kenny's building for all of us is this community that helps all of us get better. And we all have some strengths, and if there's some wisdom that we can share with each other when we're shining bright, right? Things are going well and we're crushing it, or salesperson of the year, right? And versus someone when maybe they're not, maybe struggling a little bit or looking for a job or frustrated, and like guess what, those roles are going to be reversed, and we will all have moments of brightness and darkness. And so if we collectively as a team can help each other uh, get through those times, good and bad, I think that's really special. So yeah, feel free to reach out anytime. Happy to help anyone.
Awesome. Thank you, Brian. Again, just so much appreciate the value you add, your approach to business, your approach to our industry as a whole, as far as adding value first and leading with value. I know I've learned a lot. I think anybody that's on the call live here, and certainly we're going to record this and keep it on the lobby platform. That way, anybody that's coming through in the future maybe couldn't attend today, they'll get that value as well. So thank you so much for all the lives you're impacting and for being here today and making time for us.
Pleasure's mine. Thanks all. Appreciate you. Keep up the great work, everyone.
Thanks, guys. Thank you for everybody that attended. And we'll see you in the lobby.